Hi everyone, it's your friend Dr. Birbal Kumar. Today, I want to talk about something that many of you have asked me about, varicose veins and what happens after treatment. Specifically, we're diving into a procedure called endovenous laser ablation, or EVLT. Now, this is a fantastic and highly effective treatment we use to close down those troublesome, bulging veins. It has brought relief to so many people, helping with the pain, swelling, and appearance of varicose veins. It's truly a game changer in vein care, and I've seen incredible results in my practice. But, and this is an important but, like with many things in medicine, it's not always a one-and-done situation. Sometimes, even after a successful laser treatment, those varicose veins can come back. This is what we call recurrence, and it's something I want to be completely transparent about with all of my patients. It's a topic that can cause a lot of concern, so I want to pull back the curtain and explain why this can happen. Knowledge is power, and understanding the why helps us work together to achieve the best possible long-term results for your health. The good news is that significant recurrence isn't the norm, but the chances of it happening can vary quite a bit from person to person. The rates you might see in studies can range anywhere from a small percentage to a more noticeable number over several years. This variation is because there isn't just one single reason for recurrence. Instead, it's a combination of different factors, some related to the initial treatment, some to your own unique body and genetics, and others to your lifestyle. Today, we're going to explore these reasons together, step by step. So, let's start with one of the most common reasons we see for recurrence, what we call an incomplete initial treatment. Imagine you're weeding a garden. If you only pull the tops of the weeds and leave the roots, what happens? The weeds grow right back. It's a similar concept with varicose veins. The bulging veins you see on the surface are often just the tops of the weeds. The real problem, the root, is often a deeper, unseen vein that isn't working properly. This is usually the great saphenous vein or the small saphenous vein. The job of the laser is to go in and seal off that main, problematic root vein. If, for any reason, that initial laser procedure doesn't fully treat the entire length of the faulty vein, or if it misses a significant branch that's also contributing to the problem, it's like leaving some of the root behind. You might see a great improvement at first, but over time, that remaining section of untreated vein can continue to cause pressure to build up. This pressure will eventually find a new path, creating new varicose veins. That's why a thorough initial ultrasound mapping is so critical. We need to identify the entire problem area to make sure we're treating the cause, not just the symptom. This next point is closely related to our first one, and it's a biggie. It's all about something called venous reflux. Now, what is that? Healthy veins in your legs have tiny one-way valves that open to let blood flow up towards your heart and then close to stop it from flowing backward. Reflux is what happens when these valves become weak or damaged. They don't close properly, so gravity pulls blood back down the leg, causing it to pool. This pooling is what creates the high pressure that leads to varicose veins. The whole point of the laser treatment is to eliminate this reflux by closing the faulty vein. So, a major predictor of whether veins will come back is if there's still reflux happening after the procedure. This is what we call persistent reflux. It could be that the main vein we treated wasn't fully sealed, or maybe there was another secondary source of reflux in a different vein that wasn't addressed. We check for this during follow-up appointments using an ultrasound. If we see that blood is still flowing backward in that area, it's a clear sign that the pressure is still on, and the risk of new varicose veins forming is much, much higher. It's the engine that drives the whole problem. Now, let's talk about something that we have a bit more control over. Our body weight. Carrying extra weight, especially around the abdomen, can have a significant impact on the veins in your legs. Think of it like this. That extra weight puts more pressure on your entire circulatory system, but especially on the veins in your lower body that have to work against gravity to push blood back up to the heart. This constant increased pressure is known as venous hypertension, and it puts a major strain on those little one-way valves inside your veins. This strain can make it harder for the valves to close properly, which can either cause new vein problems to develop or worsen existing ones. So, even if we've successfully treated a varicose vein with a laser, if the underlying issue of high venous pressure due to obesity isn't addressed, the body is still under strain, This makes it more likely for other veins to fail over time, leading to recurrence. Maintaining a healthy BMI is one of the most powerful things you can do to support your vein health both before and after any procedure. It reduces the overall load on your system. Okay, let's get a little more technical for a moment because this is really important. Your legs have two main systems of veins, the deep system, which is nestled within your muscles, and the superficial system, which is closer to the skin. The varicose veins we see are part of that superficial system. Now, connecting these two systems are small veins called perforator veins. Their job is to drain blood from the superficial veins into the deep veins. They are like little connecting bridges. Just like the other veins, these perforators have one-way valves to make sure blood only flows in one direction, from superficial to deep. If these perforator valves fail, we get what's called perforator incompetence. Blood can then flow the wrong way, from the deep system back out to the superficial system. This creates a localized area of high pressure. If you have incompetent perforators that aren't identified and treated during your initial procedure, they can act as a persistent source of pressure, feeding into the superficial veins and causing varicose veins to pop up again, even after the main saphenous vein has been sealed. The human body is truly amazing in its ability to heal and adapt. But sometimes, that healing process can, actually work against us. This brings us to our next cause of recurrence, a fascinating process called neovascularization. The term sounds complicated, but it simply means the formation of new blood vessels. After we use a laser to close a vein, the body sees this as an injury that needs to be repaired. In response, it can sometimes start to grow a network of tiny new veins around the top of the treated vein. These new vessels can try to reconnect the circulation, essentially creating a bypass around the part we sealed off. It's the body's attempt to restore blood flow. Unfortunately, these new veins are often weak and lack proper valves, just like varicose veins. So, this new network can re-establish a pathway for reflux, allowing blood to flow backward and pool once again. This process typically happens over a longer period, sometimes a year or more after the initial treatment, and it's one of the more challenging causes of recurrence to predict and prevent. It's honestly a testament to the body's resilience, even when it's not exactly helpful. This next one is a little different from neovascularization, but can have a similar outcome. It's called recanalization. While neovascularization is about growing new veins around the treated area, recanalization is when the original treated vein itself reopens. When we perform laser ablation, the goal is to use heat energy to damage the vein wall, causing it to collapse and seal shut. The body is then supposed to gradually absorb and break down this sealed vein over time. It essentially turns into a tiny thread of scar tissue. However, in a small number of cases, this process doesn't complete fully. The vein fails to scar down permanently, and over months or even years, a channel can reopen right through the middle of that treated vein. Blood flow is re-established, and if the valves in that section were faulty to begin with, the reflux and the original problem can return. The risk of this happening can be related to the amount of energy used during the procedure or the specific characteristics of the vein itself. It's another reason why follow-up ultrasounds are so important, as they allow us to see if the vein has stayed successfully closed. We started with the idea of an incomplete treatment, and I want to come back to it because it really ties everything together. Inadequate initial treatment is a broad term that covers a few different scenarios. It could mean, as we discussed, not treating the full length of the main problem vein, but it could also mean not using enough laser energy to ensure the vein wall is sufficiently treated to close down permanently. If the energy level is too low, the vein might close initially, but be more prone to reopening or recanalizing later on. Furthermore, a truly comprehensive treatment plan looks beyond just the single main saphenous vein. It involves carefully mapping your entire leg to identify all significant sources of reflux. This includes major tributary branches and those incompetent perforator veins we talked about. If these other faulty veins are not addressed at the same time, either with the laser or through other techniques like sclerotherapy, they remain as active sources of venous hypertension. They will continue to put pressure on the system, making it highly likely that new varicose veins will develop, sometimes in the exact same area. It's all about treating the entire problem, not just one part of it. So as you can see, preventing varicose veins from coming back is a team effort and a multifaceted process. It's not just about the single day of the procedure. Minimizing the risk of recurrence truly begins with a very thorough preoperative evaluation. This means a detailed ultrasound mapping to identify every single source of reflux, the main veins, the branches, and the perforators. From there, it's about applying the correct technique during the procedure, using the right amount of energy to ensure a durable and permanent closure of all the problem veins we've identified. But the journey doesn't end there. Consistent follow-up appointments are absolutely key. They allow us to monitor the treated veins with ultrasound to make sure they've stayed closed and to catch any new issues early on before they become a bigger problem. And finally, a huge part of your long-term success is in your hands. Making healthy lifestyle choices, like maintaining a healthy weight, staying active, and wearing compression stockings if recommended, reduces the overall strain on your leg veins. This helps protect the veins we've treated and reduces the risk of new ones forming in the future. Ultimately, every person's venous system is unique, and the best strategy for you will be a personalized one. The most important thing you can do is have an open and honest conversation with your vein specialist. Don't hesitate to ask questions about recurrence and what your specific risk factors might be. We are here to be your partners in health, to create a comprehensive plan that gives you the very best chance for healthy, happy legs for years to come. Thank you for joining me today, and I look forward to seeing you again soon.